Frozen shoulder, clinically termed adhesive capsulitis, is a debilitating condition characterized by progressive stiffness, pain, and limited range of motion in the shoulder joint. This condition typically manifests in three distinct stages: the freezing stage, the frozen stage, and the thawing stage, each presenting unique symptoms and challenges for those affected. During the freezing stage, individuals may experience a gradual onset of shoulder pain, often worsening with movement or pressure. This stage is marked by increasing stiffness in the shoulder joint, which may hinder daily activities such as reaching overhead or behind the back. As the condition progresses, the range of motion in the shoulder becomes noticeably restricted, leading to difficulty in performing even simple tasks. The frozen stage is characterized by persistent pain and stiffness in the shoulder joint, often reaching its peak severity. Individuals may find it exceedingly challenging to move their shoulder in any direction, and the joint may feel completely immobile. This profound loss of mobility can significantly impact the individual's quality of life, limiting their ability to perform routine activities and affecting their overall well-being. The final stage, known as the thawing stage, involves a gradual improvement in shoulder mobility and a reduction in pain. While the symptoms may gradually diminish over time, the recovery process can be slow and unpredictable, lasting anywhere from several months to several years. During this stage, physical therapy and targeted exercises play a crucial role in restoring range of motion and strength to the shoulder joint. While the exact cause of frozen shoulder remains unclear, several factors are believed to contribute to its development. These include inflammation of the shoulder capsule, scarring of the connective tissue surrounding the joint, and hormonal imbalances. Additionally, certain medical conditions such as diabetes, thyroid disorders, and autoimmune diseases have been linked to an increased risk of developing frozen shoulder. Diagnosing frozen shoulder typically involves a thorough physical examination, including an assessment of the individual's medical history and a series of mobility tests to evaluate shoulder function. Imaging studies such as X-rays or magnetic resonance imaging (MRI) may also be performed to rule out other underlying conditions and assess the extent of joint inflammation and tissue damage. Treatment for frozen shoulder focuses on alleviating pain, improving shoulder mobility, and facilitating a gradual return to normal activities. Non-surgical approaches may include over-the-counter pain medications, corticosteroid injections to reduce inflammation, and physical therapy to stretch and strengthen the shoulder muscles. In more severe cases, where conservative measures fail to provide relief, surgical interventions such as shoulder manipulation under anesthesia or arthroscopic capsular release may be considered to release the tight capsule and restore joint mobility. Overall, frozen shoulder is a challenging condition that can significantly impair shoulder function and diminish quality of life. However, with early diagnosis and appropriate treatment, many individuals can achieve significant improvements in symptoms and regain functional use of their shoulder joint over time. Ayurveda aspect about frozen shoulder or avabhaka. In Ayurveda, frozen shoulder is referred to as avabhuka, which is a condition that affects the shoulder joint and is characterized by stiffness, pain, and limited mobility. According to Ayurvedic principles, avabhuka is primarily caused by an imbalance of the vata dosha, which governs movement and coordination in the body. When vata becomes aggravated or imbalanced, it can lead to the accumulation of toxins ama in the shoulder joint, causing inflammation, stiffness, and pain. Ayurveda views avabhuka as a condition that affects not only the physical body but also the mind and spirit. Imbalances in the mind, such as stress, anxiety, or emotional tension, can exacerbate vata dosha imbalances and contribute to the development of avabhuka. Treatment of avabhuka in Ayurveda focuses on restoring balance to the vata dosha reducing inflammation and improving mobility in the shoulder joint. This typically involves a holistic approach that incorporates dietary changes, lifestyle modifications, herbal remedies, and therapeutic techniques. Dietary modifications. Ayurvedic practitioners may recommend dietary changes to pacify vata dosha and reduce inflammation in the body. This may include consuming warm, nourishing foods such as soups, stews, cooked grains, and herbal teas. Avoiding cold, dry, or processed foods that can aggravate vata dosha is also important. Herbal remedies. Various Ayurvedic herbs are known for their anti-inflammatory and analgesic properties, which can help alleviate pain and inflammation in the shoulder joint. Commonly used herbs for avabhahuka include ginger, turmeric, ashwagandha, gugulu, and boswellia. These herbs may be taken internally as supplements or used topically in the form of oils or poultices. Lifestyle modifications. Practicing lifestyle habits that promote relaxation and stress reduction can be beneficial for managing avabhahuka. This may include incorporating regular exercise, yoga, meditation, and deep breathing techniques into daily routine to calm the mind and balance vata dosha. Therapeutic treatments. Ayurvedic therapies such as Abhyanga warm oil massage, Panchakarma detoxification treatments, and Swadhana herbal steam therapy can help to alleviate stiffness, improve circulation, and promote healing in the shoulder joint. Additionally, specific therapies such as Basti medicated enema or Janu Basti localized oil therapy may be recommended to target the affected area directly. Pranayama and yoga. Practicing specific breathing exercises, pranayama, and gentle yoga asanas that focus on stretching and strengthening the shoulder muscles can help improve flexibility and mobility in the shoulder joint. However, it's essential to practice under the guidance of a qualified yoga instructor or Ayurvedic practitioner to ensure proper technique and avoid exacerbating the condition. Overall, Ayurveda offers a holistic approach to managing avabhahuka that addresses the underlying imbalances in the body, mind, and spirit. By restoring balance to the vata dosha and supporting the body's natural healing processes, individuals with avabhahuka can experience relief from pain and stiffness and improve overall shoulder function over time. It's important to consult with a qualified Ayurvedic practitioner for personalized recommendations and treatment guidance based on individual constitution and imbalances. Thank you for watched my video. Please subscribe my channel.